Hi, my name is Joe Whiteside. I'm the clinical director here at Anatomical Concepts, and the purpose of today's video is to show you the appropriate application and donning and doffing of our new articulated RIBBY ankle foot orthosis. What the RIBBY consists of is the actual device itself, as you can see here. We also provide an open-toed post-op shoe that will accommodate various foot lengths, pretty broad patient population and foot size. When you first place the orthosis on the patient, or before you do that, you want to go ahead and release all the Velcro straps. There's two Velcro straps, one on the lower shin and this one on the upper calf area. It's a good idea to fasten the pile part of the Velcro to the hook just so it keeps from getting tangled up with the other straps on the actual device. The orthosis can actually be donned or placed on the patient either in a recumbent position, as you see here, with the patient's leg over the edge of the bed or chair. If they're lying down, you want to make sure that you bend or flex the knee slightly. What that does, it lengthens the musculature on the back of the calf, allows you to pull the foot up to a 90-degree position much easier than if it was straight. If you can't get it to 90 degrees, the actual RIBBY has the ability to adjust both dorsiflexion and plantar flexion position with a couple of set screws here, and we cover that in separate videos on our website. I'll go ahead and cover this back up. It's real simple. Just slide that back over the screw area there. Allows for the adjustability. To proper position it on the patient, you want to raise the patient's extremity, place the heel in the middle of the foot plate. That is between the end of the toe and the actual back of the heel. You can slide the patient's extremity or foot back into the foot section so that it just almost comes in contact with the back of the insert right here. Ideally, you want to leave a little bit of a gap. Secondarily, you want to assess the alignment of the patient's actual calf in relationship to the calf section of the RIBBY and make sure that the heel isn't pushed back too far or too far forward. You want that to be parallel with each other. Another assessment that you want to do at this time is, again, the length or position of the actual insole. If it's not in the proper position, just take the patient's extremity out of the device. You can easily release with Velcro here and pull it completely away, reposition it properly, either more forward, down towards the toes, or back towards the heel, whatever's most appropriate for your patient so that it fits appropriately, again, keeping just a slight gap between the back of the insole and the patient's actual heel. Once you position it properly in the extremity, or the patient's extremity in the device, the next thing you want to do is go ahead and position the post-op shoe. I've already unfastened the distal strap or the bottom strap. Go ahead and unfasten the upper strap. Gently raise the patient's leg up. Make sure the heel bar is all the way back into the foot section of the heel section of the post-op shoe. Making sure that the foot is actually bottomed out of the bottom of the actual RIBBY AFO is touching the insole of the shoe itself. Then you want to go ahead and fasten the upper or the strap that's closest to the ankle first. That keeps the heel seated securely down inside the foot section of the RIBBY, and then proceed with the lower foot section, securing that. Next, you want to go ahead and proceed and work your way up the extremity. And fasten the lower distal calf strap next, and then you want to do the upper calf strap, proximal calf strap last. And at this point, you can actually trim the strap. If needed, you can trim it to appropriate length, and usually it's a good idea to leave a little extra just to accommodate for fluctuations in the volume of the patient's extremity. Additionally, with the RIBBY, unlike our other two articulated AFO systems that have the same configuration with the shoe, is that it has free dorsiflexion. And the advantage of this free dorsiflexion, it allows the patient, when their foot's flat on the ground, they can move their leg forward over the foot itself, allowing them to transition out of the chair easily, also providing a passive stretch on the back posterior calf musculature to provide some stretching there as well. Again, you want to reassess the positioning of the actual device as it relates to the patient's extremity at this point. If everything looks good, the heel's down in the heel base and you're secure as far as the straps go. Everything's ready to go, and that's a general overview of our RIBBY articulated AFO and the proper positioning and application. Thank you.